Good evening. I'm psychiatrist Jay Fawver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues that I can answer on the air, you may write me or you may contact me by phone tonight at 969-2720 if you're in the Fort Wayne area. If you're calling any place else, you may dial toll-free at 866-969-2720. Now, on a fairly regular basis, I am broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at WFWA.org. That's Matters of the Mind at WFWA.org. And I'll start tonight's program with a question I recently received. It reads, Dear Dr. Fawver, what kind of lifestyle changes will help with my symptoms of depression, and are there any alternative treatments other than medication? Well, the alternative treatments other than medication can always be counseling, talk therapy. You can have a coach in your life. The idea of alternative treatments outside of medication will be to help you navigate to your intended goal. So if you think about the medication as being like an accelerator or a brake, you know, this chemical called glutamate is the accelerator, the brake is GABA. So in the gray matter of the brain, you've got this accelerant, glutamate, and GABA is the brake, and they're balancing each other out. Now then you've got serotonin, norepinephrine, and dopamine coming from the brainstem down here, projecting in very minute amounts up to the gray matter of the brain, giving advice to the accelerator and brake. So serotonin, dopamine, norepinephrine, those are neurotransmitters that we're trying to target with various traditional antidepressant medications. We're trying to target their effects on glutamate and GABA. So the biological aspect of treatment of depression will be with medication to try to get the brain working better, but counseling, talk therapy, coaching, group therapy, those type of things, support groups especially, what they help you do is try to navigate you to your eventual goal. They're kind of helping you steer the life vehicle to get you where you need to be. So that's what we'll often recommend for people. What kind of alternative treatments can you do? Well, exercise is the very best thing you can do to help with depression, because exercising itself will actually increase brain fertilizer. It's called brain-derived neurotrophic factor, but exercising can increase brain fertilizer and make your little neurons more fluffy. Because when you're really stressed out and you're having trouble with depression for a long period of time, your neurons, they don't die off. It's just that they become less fluffy. So instead of having 30,000 little fluffy branches on your neurons, you might have just 10 or 20,000 branches. So what exercise will do in a similar manner with many medications, you're trying to make your little neurons more fluffy, and fluffy neurons work better. That's the first thing you can do. Second thing you can do will be try to do things that are fun. Many people, when they get depressed, they start giving up things that used to be enjoyable for them. So if you give up enjoyable activities, you tend to have more depression, and it becomes a vicious cycle in that way. With more depression, you don't want to do the things that used to be fun. So try to get yourself to do things that used to be enjoyable, and that includes socializing. During the COVID pandemic, when we had the lockdowns and people were socially isolated, there was not only a pandemic of COVID that was being discussed, but there was a pandemic of mental health issues, because mental health issues just escalated during all that social isolation, because we know that lack of socialization is certainly a risk factor for depressive conditions. So for that reason, socialization can be very, very important for many people. You have to have some kind of purpose. You have to have some kind of meaning in life. So it's important for you to try to identify what kind of things you have for which to live. So what are your life goals? What are your aspirations? Why are you here at this time to be able to serve others and serve God? So what's your overall purpose and meaning in life at this point? And going along with that, what kind of things are you joyful about? What kind of things give you gratitude? And what kind of things are you grateful for experiencing? We often think about the different conflicts and the things we have that trouble us, but it's very, very important for us to perhaps even keep a journal about the things that for which you might be thankful. And gratitude often leads to happiness itself. So a lot of different things you can do to try to help you, from lifestyle changes as well as alternative treatments for depression. But that would include the treatment with medications if you're getting to the point where you're what we call functionally impaired. We will use medications for people who are having trouble socializing, going to work, doing the things they ordinarily would do because of the depth of their depression. So that's where medications will make the brain work more normally to try to get you back on track. Thanks for your email. Let's go to our first caller. Hello, Rod. Welcome to Matters of the Mind. Rod, you had mentioned you have a family member who refuses to take their medication daily. You'd like me to explain the importance of taking medication as prescribed and not just during an episode. It depends, Rod, because some people, for instance, you'd mentioned anxiety medication, some people will only have a panic attack about every 2 weeks. I don't have any trouble with that person situationally taking a medication at that time. We hear about it all the time where people will have difficulty with a public speaking type of situation. And during that time, they might take a medication that blocks adrenaline called propranolol, and they only take it during that time. The rest of the time, when they're not under those kind of stresses, they don't need to take the medication. So there are some situations where people can indeed take medication for anxiety just as needed. We'll even have people take a medication like Xanax, also known as alprazolam, just as needed, for instance, to get on a plane. They'll be in the boarding area. They'll take the Xanax at that time before they get on the plane and they get in that enclosed fuselage. And while they're encountering turbulence upon takeoff, perhaps they're calm during that time. And the more times you do something, whether it's flying in a plane or public speaking, the easier it gets. So sometimes we will have somebody do this episodic treatment for their anxiety. The same will go for anxiety related to premenstrual symptoms for women. We might have women just take a serotonin medication like Zoloft or Prozac just on the 5 or 7 days before their periods, and it'll work fine. So there are times where you can take a medication episodically. Now here's the situation in which you may be referring. Somebody who is having overwhelming, life-impairing anxiety on a day-to-day basis, not willing to take a medication day by day. Okay, if they have talk therapy, if they exercise, if they try to do all the right things in life, that's fine. But some people, despite trying to do all those different things, will still have incapacitating anxiety and impairment in trying to do the things they're trying to do. So for those people, you bet. It's all coming down to, do you feel better on the medication or do you feel better not on the medication? Right now we have 29 different antidepressants from which we can choose, going all the way back to 1958 when they first started coming out. So the antidepressant medications not only help with depression, many of them do help with anxiety if you take them day by day by day. So if you feel better on the medication for anxiety on a daily basis, that's great, but there are medications like Xanax, Ativan, Valium, Klonopin. We don't want people necessarily taking those every day if they can get away with it. And then there's medications that are the so-called gabapentinoids. These are anti-seizure medications that have a little bit of different effect than the so-called benzodiazepines do, the Xanax, Ativan, Klonopin, Valium. The gabapentinoids are gabapentin and pregabalin, which will be Neurontin and Lyrica, respectively, but these medications work a little bit differently on the nerve themselves, and they give the nerve a little bit less of an itchy trigger finger, so the nerves aren't as likely to fire excessively, which for some people will give them anxiety. So we might have them take gabapentin or Lyrica sometimes on a day-to-day basis, but even with those medications, occasionally we are indeed having people take them episodically. So I think it just differs from person to person, Rod, and I think it's something in which your family member can discuss with their clinician. Thanks for your call. Let's go to our next caller. Hello, Kent. Welcome to Matters of the Mind.
Hello.
Hi, Kent.
I have a question concerning congestive heart failure and medications. Are there medications that should be avoided if one has congestive heart failure but also has issues with anxiety, PTSD, depression?
Right off the bat, Kent, you mentioned congestive heart failure. When somebody has congestive heart failure, sometimes they are prone to having a little bit lower blood pressure than usual. Is that the case for you by chance?
Yes.
Yeah. So for you, 3 medications come to mind concerning the use for post-traumatic stress disorder that might not be able to be used with somebody who has congestive heart failure: prazosin, guanfacine, and clonidine. Those are 3 medications that are often used for PTSD symptoms because they make you less jumpy, they decrease nightmares, they decrease the so-called hypervigilance, where you're always on edge during the daytime. So we probably wouldn't want to use prazosin, clonidine or guanfacine for somebody with congestive heart failure. What would we use? We'd probably be more inclined to use the serotonin medications. By chance, are you on a blood thinner like Coumadin, warfarin, anything like that?
Yes, I am.
In those cases, yeah, if you're on a blood thinner like Coumadin, warfarin, what they will do, we call them blood thinners, but what they do basically is they make the platelets less sticky. So you're less inclined to having sticky platelets. Sticky platelets will cause you to have blood clots. So people will take medications to make their blood thinner in that regard. But if you're on those kind of medications, well, you probably don't want to be on a serotonin medication. A serotonin medication would need to be used very cautiously, because if you're on a medication like Coumadin or warfarin or anything that's making your blood less sticky, your platelets less sticky, the serotonin reuptake inhibitors, the so-called SSRIs like Zoloft, Paxil, Lexapro, Celexa, they can also make the platelets less sticky. In other words, they are blocking the vacuuming of serotonin back into the platelets as well as the neurons. If you block the vacuuming of serotonin into the platelets don't get sticky, and they can't stick together so well, and that's why people, when they're taking serotonin medications, are probably going to be more inclined to have difficulty with little petechiae, which are little mini bruises all over them. And if you're taking that with warfarin, that can be an issue. So a medication that lowers your blood pressure might not be in the best interest for you, even though you'd have PTSD. Zoloft, Celexa, Lexapro, Paxil, if they're used, they have to be used very cautiously for somebody on a medication that's also a blood thinner and making the platelets less sticky. So then the option would be the possibility of taking a medication that's going to affect more glutamate. Now, a medication that affects glutamate is going to give you an excitatory effect in the brain itself, but in doing so can help with depression. And we're finding that secondarily, some of these medications that are affecting glutamate can also help with post-traumatic stress symptoms. So these medications can be esketamine, which is known as Spravato. It's a nasal spray given twice a week the first month, once a week the second month, and then the decrease in frequency thereafter for many people. But Spravato is affecting glutamate as a nasal spray for people who have what's called treatment-resistant depression. They failed on 2 antidepressant medications in the past, and now they're trying this. Spravato would not have an effect on your blood pressure in terms of making it go down, and it certainly wouldn't have an effect on the stickiness of the platelets. So that would be an option. Off-label, hasn't ever been approved, but ketamine. Ketamine is something that's an injection. Many people have to pay out of pocket for ketamine. Ketamine is the parent compound of Spravato. Spravato or esketamine is the left-sided piece of ketamine. Spravato has been approved by the Food and Drug Administration as well as insurances. Ketamine has not. And then a third option would be if you have depression, you could still affect glutamate by using a medication like Auvelity. Auvelity is a combination of dextromethorphan, which is an old cough medicine. It's been around for 65 years, and bupropion, which has been around since 1989 as an antidepressant. Bupropion is increasing the blood level of dextromethorphan by over 30 times and extending its duration of action by over 7 times. Bottom line is, if you have high levels of dextromethorphan in your brain, you will affect glutamate favorably. And in our experience, we have noticed that people not only get relief with depression in using Auvelity, but they secondarily can get benefit with anxiety symptoms, which are often accompanying the post-traumatic stress symptoms. So there are other options out there. I would simply advise you to be careful that careful with any serotonin reuptake inhibitors that are going to make the platelets less sticky, and be careful with any medications that might lower your blood pressure overall. Thanks for your call. Let's go to our next caller. Hello, Tony. Welcome to Matters of Mind.
Yes, Dr. Fawver. First of all, I'd like to thank you for everything you do for us.
Oh, my pleasure, Tony.
As I was explained to the gentleman before to answer the phone, I'm 74 years old. I dealt with depression since I was 37, and one of the things that comes from time to time that is sort of attacks me is obsessions. It starts as a thought, can't get rid of the thoughts, and then it becomes an obsession. And I have a hard time getting rid of that obsession, and usually basically doing a lot of praying and everything else is what has helped me. But is there anything else up there that I should be doing?
You nicely described obsessions in a sense that you're describing these thoughts that you can't get off your mind, correct? Do they seem like unnatural thoughts? Do they seem like thoughts that you don't really want to have there? And that they're thoughts that keep gnawing at you, gnawing at you, and gnawing at you, and they don't make a lot of sense?
Yes, absolutely.
Yeah. Worry is a phenomenon where you have thoughts that come to your mind, but they're realistic. You're worrying about your finances, you're worrying about your family, you're worrying about your job. Those aren't obsessions, and many people mix those up. You very nicely described what's considered to be a true obsession. An obsession basically, yeah, you're old enough to remember record players like I am, so an obsession is basically where if you have a record player, the needle's stuck, all right? The needle's stuck. And instead of getting stuck on music with a record player in your brain, the needle's stuck on a thought, and the thought doesn't make sense, and it comes back to annoy you. What's happening in the front circuitry of your brain, this is the front part of the brain looking at you. On the inside of the brain, these circuitry is going round and round and round, and it gets stuck. Now, I imagine over the course of time, you've been treated with serotonin medications like Zoloft, Paxil, Lexapro, Celexa, Luvox maybe? Have you had any of those kind of medications? They are all increasing serotonin and sometimes will break up some of that circuitry that's going round and round and round. Now, of those medications, 2 of them in particular will have an additional effect outside of just increasing serotonin transmission, which can break up obsessions. One is Luvox. Fluvoxamine is the chemical name of that, but Luvox, it'll increase serotonin transmission, but it will also specifically stimulate this particular receptor called sigma-1 receptors. If you stimulate sigma-1 receptors, that seems to give people an added benefit in relieving obsessions because, well, it's thought that maybe obsessions are due to inflammation. So if you stimulate sigma-1 receptors, as you can with fluvoxamine or Luvox, you can decrease the obsessions in that manner. And that's why a lot of us believe that fluvoxamine or Luvox works a little bit better than many of the other medications used for obsessions. Zoloft or sertraline also has a little bit of a sigma-1 activity, but not as much as Luvox. Luvox as a sigma-1 stimulator was used during the COVID pandemic when people had COVID infections, and 50 milligrams a day was used to decrease the inflammation in the lungs because it has anti-inflammatory effects. So it's thought that if you have obsessions, part of the reason you have obsessions is because there is an inflammatory element going on in the brain, and a medication like Luvox could possibly be helpful for that.
Okay. Okay, thank you very much, Doctor.
My pleasure. Thanks for calling in.
All right, bye-bye.
You bet. Let's go to our next caller. Hello, Dean. Welcome to Matters of the Mind. Well, let's go to our next email. Looks like our next caller might not be there. Let's go to our next. Oh, Dean, you have a question for me? Well, Dean, I think. Oh, okay. Dean, it sounds like you wondered how to deal with the stigma of having a mental illness. Dean, it used to be much more pronounced back in the 1990s, 1980s, where people with depression, anxiety had a lot of stigma about getting treated for mental health issues. Now we know enough about the neurobiology of depression, anxiety, mood swings that we understand that these mental health conditions have a neurobiological component. In other words, there's a chemical component to all this, and the chemical component is such that we know that there are means of treating this. How do we know? Well, I mentioned earlier in this, the fluffiness of the neurons. With fluffy neurons, your brain tends to work better. You can actually put markers in people's brains, just temporarily, put them under a functional scanner and actually see how fluffy their neurons might be. And this can be done obviously in research settings, but it's identified that especially in the hippocampus, in this yellow part of the brain, in the amygdala, the anxiety part of the brain, those parts of the brain just shrivel up when people get depressed for long periods of time. So we understand now, where we didn't back in the 1990s, 1980s, we understand now there's a biological component to psychiatric conditions. So I think the first thing to deal with the stigma of having a mental health issue, think of the stigma of having a heart condition, a stigma of having cancer, the stigma of having any illness itself. This just happens to involve the brain. But I think we've come a long way in the past 30 years in dealing with the stigma of a mental health issue. because we're understanding more of the biology that's based behind it as opposed to it being simply an attitude problem. Dean, thanks for your call. Let's go to our next caller. Hello, Ann. Welcome to Matters of the Mind. Dan, you mentioned that you have a sibling who's confessed to having an alcohol problem. He has bipolar disorder type 2 and 3 other health conditions overall. So having a sibling having an alcohol problem with bipolar 2 disorder, bipolar 2 disorder, as you may know, Ann, is where somebody will have 4 to 6 days of having little highs that aren't highly functionally impairing, but then they have these devastating big lows for over 2 weeks where they get very depressed. And the fact that they're having little highs and then big lows, the lows can be even more pronounced because they've kind of been to the mountaintop a little bit here and then they go down and they crash. So if you have bipolar disorder type 2, if you're inadequately treated, you're not uncommonly going to resort to alcohol or some kind of substances of abuse to give you some relief. And I've seen some people with alcohol dependence and they end up in the hospital with alcohol dependence, and they started out drinking alcohol just to sleep. And next thing you know, they were drinking more and more and more alcohol, and they kind of took off from there. So having an inadequately treated mood disturbance can sometimes increase the likelihood that somebody's going to drink more and more and more. So the first thing I'll often do, and if I hear about somebody having trouble with alcohol, I'm going to go back to asking, okay, when you started drinking, and when it started especially to become problematic, what was going on in your life at that point? How were you feeling? What's alcohol do for you? I saw a person a week ago who said the alcohol helped him sleep. And next thing you know, he just started drinking more and more to sleep. I've seen people who say alcohol is the only thing that makes them feel happy. Well, for those people, yeah, they're very prone to having alcohol dependence, because if alcohol stimulates your brain, and it stimulates your brain in such a way that it goes to this little area here in the middle here called the nucleus accumbens, that part of the brain, if stimulated, will fire off dopamine, and when it fires off dopamine, it gives you a feel-good effect. It doesn't happen for everybody, but for some people, and it's a big warning sign, but for some people, if they feel really happy when they drink alcohol, they're more prone to getting in trouble with it. So what we're often doing is we're going back and we're trying to give them adequate mood stabilization with a medication that's going to level out the mood so they won't have the highs and the lows. And if they're having trouble sleeping, okay, let's give them something that would be not addicting for sleep. And we're doing that at the same time as crisscrossing them, getting them off the alcohol while starting some other medication to try to give them some relief at the same time. So, yeah, could you tweak the medication and one way or another? If he's still drinking, if your sibling is still drinking, by all means, he probably needs to have further adjustments with his medication. Alcohol, obviously, is not a real good medication for depression or sleep. People sometimes wonder about that. They say, if it makes me feel good, why couldn't I still use it? It's because you often need more and more of it to make you feel good. Why can't you use it for sleep? Well, it'll knock you out and help you get to sleep, but it gives you a very poor quality of sleep thereafter. A poor quality of sleep is problematic because if you don't sleep efficiently, you're not getting the deep sleep, you're not getting the dream sleep, which alcohol will suppress. You'll have trouble with your cognition, your memory, your attention span, your ability to keep track of things. So if you have impaired sleep, that will be problematic all by itself. Let's go to our next caller. Hello, Janet. Welcome to Matters of the Mind. Janet, you want to know about how common it is for a daughter to abandon her mother since she's gotten older, prior to having a great relationship. What would cause a person to do this? I think you're wondering why a daughter would no longer want to have a relationship with her mother when the mother is getting older. That's very individual, very difficult to really determine, Janet. If you already had a pre-existing poor relationship with a parent, yeah, that can be problematic later on. We're instructed in the 10 Commandments, Commandment number 5, that we're supposed to honor our parents. Now, honoring them might not mean really liking them or agreeing with everything they've taught you or respecting them in some ways, but we need to honor them, and that means taking care of them. Why would a person no longer have a great relationship with their parent? I think that's really individual based on that particular setting. Thanks for your call. Let's go to our next caller. Hello, Fred. Welcome to Matters of the Mind. Well, Fred, you mentioned you take 10 milligrams of buspirone for anxiety. 10 milligrams of buspirone, common dosage. Many people will take 10 milligrams twice a day of buspirone for anxiety. Many people will get up to 30 milligrams twice a day. Buspirone is basically, Fred, for worry. And not so good for panic and really bad anxiety. But if you tend to ruminate about things and you worry about stuff, you don't have obsessions. Obsessions are beliefs and thoughts that don't make any sense to you. You don't want them there. Worries have to do with things that are bothering you day by day. So you'd mentioned the bottle says it can also be used for pain. Buspirone usually is not used for pain, Fred. Now, if that's a medication like duloxetine, yep, that can be used for pain, but buspirone is mainly going to affect these little serotonin receptors to stabilize the effect of serotonin. To help with pain, usually you need effects on norepinephrine as well. So buspirone is not typically going to help with pain as well, unless you could identify the pains associated with anxiety. Some people have irritable bowel, and they have pain associated with that. If you have irritable bowel and buspirone helps it, that's great. Fred, thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues that I can't answer on the air, you may write me via the internet at mattersofthemind@wfwa.org. I'm psychiatrist Jay Fawver, and you've been watching Matters of the Mind on PBS Fort Wayne. God willing and PBS willing, I'll be back again next week. Have a good night.
Preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.